If you are tired and think there might be something wrong with your thyroid, but your doctor says that there's nothing wrong, stick with me because we're going to really dive into how the thyroid could be related to your low energy and how we need to order the appropriate labs to really diagnose you with a thyroid issue and how it could be really related to your low energy.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and an integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body down to the root cause and get your energy back without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. I recently filmed a podcast with my co-host, Teresa Marie, in which we talked about the thyroid. Make sure you stick around till the end because we're going to talk about what labs specifically need to be done to really diagnose thyroid appropriately. The thyroid is so important. It works on every tiny little cell throughout your body. For you to actually have metabolism, meaning actually have your cell go throughout the processes to actually make ATP, which is energy to make all cells work effectively throughout your body, you need thyroid hormone. So let's say your thyroid hormone is low, all these mechanisms of action are not going to work very well. So you're not going to be able to feel energetic, you're not going to think very well, your hormones aren't going to be balanced because it's working on every tiny little aspect of your cells. So it's a very important substance. It's not something you just want to mess around with. You don't want to just sit around and not treat your thyroid because you don't want to take a thyroid hormone, or you don't want to take a certain supplement to help support your thyroid production because you think you're feeling decent, because it will affect every cell, even your immune system. So you're going to be even more readily going to get sick because, like I said, it affects every cell and how it makes energy production, and you're just not going to work very well without your thyroid.
So it sounds to me like, ATP is the energy that's in our cells, and some of those cells might affect our actual energy that we feel, I'm awake, I'm alert, I'm feeling good, that kind of a sense. But also just, it seems like any part of your body and all the things that your body does, if the cells don't have the energy to do what they're going to do, what they need to do, then it seems like you're going to have tons of symptoms that maybe a lot of people attribute to, I'm just getting older or whatever, and no, it's like, no, there's actually a root cause, and you can feel so much better just by taking care of your thyroid. So that's fascinating. Now, does it typically happen all at once? Like if somebody's having a thyroid issue, is it like they wake up one day, their thyroid's not working well, and boom, they got hit by a truck kind of symptoms, or is it like a slow fade?
It's almost always very slow. It's a gradual process. And sometimes people might not really notice what's going on. They just feel like, I don't think I'm feeling as good as I used to. And then if you really talk to people that haven't seen you for a while, you're like, yeah, you're acting pretty tired. You're not as energetic as you used to be, or you're not really as lively, or you're not as happy as you used to be because it's the thyroid issue. So let's really dive into, like I said, I worked on every tiny little cell. Let's specifically go dive into this a little bit more specifically. So I said it works on every cell energy production. So it also affects your ovaries and your adrenal glands. So it's going to mess with every hormone throughout your body. Your adrenal glands makes cortisol. It makes aldosterone, which helps you regulate your kidneys. It helps make estrogen, progesterone, DHEA, testosterone. Our ovaries make estrogen and progesterone. Our testes make testosterone. So if your thyroid's not working very well, guess what? You're not going to be making these hormones very well. So if you have low hormones, it's going to maybe cause hormonal imbalances. And maybe you have been diagnosed with hormonal imbalances. Maybe you've been diagnosed with PCOS or PMS or endometriosis or whatever, and they're ordering not the appropriate testing and they're not really finding out what's going on with your thyroid. You're not going to get all the way better because you're not really treating what might be the true cause of all your hormonal issues is related to your thyroid. Because if you have the thyroid not working very well, every tiny little hormone is not going to work very well. And that means you're not getting the appropriate messages throughout your entire body to be able to function very efficiently. So let's talk about how it even affects the gut. So obviously people that are dealing with thyroid issues can get constipation because it affects the motility, the movement of nutrients or food throughout your gut. So if that's not working appropriately, it's going to affect your nutrient absorption. Also, the thyroid is needed for replication of all cells. So for you to heal and regenerate, you need your thyroid to work very well. And our gut is regenerating its cells all the time. So if your thyroid's not working very well, you're not able to regenerate those cells, so you're not able to heal very well, which is then further going to detriment your nutrient absorption. And then we don't even need to dive into how that affects our energy production or just how we feel and think. Is every mechanism in our bodies need nutrients to be able to function appropriately too. So for us to appropriately have appropriate brain development, so this is extremely important as children mature, for the brains to be able to develop appropriately. Like if they do have hypothyroidism, your kid's not going to be able to think very well. They're not going to talk as very well. They're not going to have be able to walk as well. Things like that. That all happens. But let's say you start getting it when you're just older, in your 20s, 30s, 40s, or older. This is going to affect how you think, how you concentrate, maybe how you remember things is all affected by this, because you're not going to be able to have your brain healing and regenerating effectively. Also, the mitochondria in your brain isn't going to work very well too, so you're not going to be able to think as well. So these are just a quick tidbit, not diving into everything that it does throughout the body, but I think you're getting a good idea how your thyroid affects everything throughout your body, and it can lead to so many different symptoms throughout your body.
And I can see how expensive this could get for somebody who doesn't know that it's their thyroid, and they're just chasing symptoms. So they're feeling fatigue, and they're like, okay, I'm buying coffee, I'm taking, mushrooms, to help me with my energy levels. I'm buying all this gluten-free food, and I'm doing all of this so I can take care of I'm taking my probiotics, and I'm eating my enzymes. And they're just, they've got like a drawer full of supplements that's costing them, hundreds of dollars each month. If they just address their thyroid issue, it could all go they wouldn't need to even do all of this as much.
Yep.
Okay. So you're a patient, you're listening to this episode, and you're thinking, okay, yeah, I'm tired. I'm constipated. I'm just feeling irritable. I may be gaining some weight. I think I might have a thyroid issue. I go to my doctor. I say, Doc, I think I have a thyroid issue. Doctor says, okay, let me run a test. Test comes back, hey, you don't have a thyroid issue. It's all in your head. Go home. What's going on there? Like, what kind of tests are typical doctors prescribing, or not? Well, I guess running for most people. And how should we be looking at these labs differently to actually really figure out if this is our thyroid?
So I probably hear this, I don't know, every day. Someone coming into me saying, hey, I'm tired, I'm lethargic, I'm not thinking very well, I might be depressed, I'm anxious. I've read all these things online that this could be related to my thyroid. I went to my doctor, they ordered a TSH, and the TSH is normal, so they said everything's good. But here's the thing, is if you're only ordering a TSH for your thyroid, you're only looking at one little piece of how the thyroid works. Okay, that looks good. But what about your free T4? What about your free T3? What about your reverse T3? Do you have an autoimmune reaction happening to your thyroid, which is making your thyroid hormones not work very well? So we need to look at all these little pieces to really diagnose it appropriately. And it happens all the time when I actually do detailed testing on my patients, that the other doctor said everything was normal, and I order it, and I was like, no way it's normal. You're not converting your T4 to T3 very, very well. You have a conversion syndrome. So you have way too little T3. That's actually what's active on the cells, actually getting all those cells working like we talked about. You need your T3. So it doesn't matter if your TSH or your T4 looks good. If you're not converting to your T3 very well, all these symptoms that we talked about, all these issues that can occur with hypothyroidism are going to be happening. And you need to work on your conversion of improving that T4 to T3, so you actually have that T3. In some instances, people need to take a pure form of T3 to really get the benefit. I even have some people that have been taking thyroid hormone for a long time, let's say levothyroxine, which is just T4. They're like, I'm taking it, but I don't really notice any benefit. My TSH looks good. My T4 looks good. But they're not looking at the T3. I ordered the T3. The T3's in the toilet. And they're not getting any benefits because guess what? The T4 needs to be converted to T3 to actually be effective. So many of my patients, we actually need to give them like a T4, T3 combo. Sometimes we just need to give them T3 by itself to really have the true benefits of how the thyroid works.
Now, is that the only solution, like taking a T3 or T4, or is there something that's happening that's preventing the body from converting T4 to T3?
Yeah.
That if you dig further down the rabbit hole of root causes, that if you addressed that issue, that could actually help your body naturally convert it better.
Definitely. So many times it can be related to nutrient deficiencies. Many times men and women, especially women, can be low in iron. and they're not converting
Low
their
in
T4
iron.
to T3 well. They could be low in B12. So let's say those vegetarians or vegans or people that don't absorb their B12 very well. They could be low in selenium and zinc. These are common minerals people are deficient in, or they could be low in magnesium. All these things are needed for appropriate conversion of your T4 to T3. So it definitely could be a nutrient issue going on. And that's usually where I start with my patients, is giving these nutrients to help support the thyroid with that conversion.
And I can see how there's a domino effect and almost like a vicious cycle, because earlier you were saying that if you have thyroid issues, it actually can cause your body to not absorb the nutrients. So then I could see it's like, okay, you've got this thyroid issue. It's preventing you from absorbing nutrients. Now, since you're not absorbing nutrients, it's making the thyroid issue worse. And you've got this like vicious cycle. So I imagine at times you're probably having to hit this, really attack it from a number of different places. You're getting them on some enzymes, helping them heal their gut, giving them some T3, some T4, and you're just really doing a lot. But over time, is this something that you can really taper down and get that person down to a minimal place of, I guess, maintenance?
Yeah, and here's an important little tidbit too. I say it affects every organ throughout your body, and there's several different organs throughout your body that help with conversion. So there's conversion that happens in your liver, there's conversion that happens in your kidneys, there's conversion that happens in your muscle cells. So all these different organs. So let's say you have something, liver not work very well, and that could be a big reason for your thyroid issues. So you got to look at all these different pieces that could be related to thyroid. So I might diagnose someone with thyroid, but I'm like, okay, what's actually going on with the body? Why do they have this thyroid issue?
And I think that's important, because I think some doctors out there who, and there are doctors out there who do prescribe, thyroid, but sometimes that's not the only answer. It's not like, okay, hey, you got a thyroid issue. All you have to do is take T3 or T4 or whatever, and you're good. It's like, well, why? Why is your thyroid not working? And if it's a liver issue, for example, the thyroid medication that they're giving you may not even work, because the liver is going to actually help your body be able to even use that thyroid. Mm-hmm. So it seems like this is why I am doing this podcast with you, Dr. Jake. I love integrative medicine. I love how you look at the body. I love how you look at the whole person and all of the different ways that everything's working to actually get to the root cause so people can actually heal. In your practice, when you have worked with people who have thyroid problems and maybe even immune system issues that happen to their thyroid, have you actually seen people actually heal their thyroid and be able to even get off medication at some point?
There's several patients that have been able to get off their thyroid hormone. Depends how long the damage has been going on to the thyroid. Let's say someone has Hashimoto's thyroiditis, which is inflammation of the thyroid. They've been dealing with this for several years, and the immune system has been rampant and has damaged a lot of the thyroid producing cells. So many times they might need to get on some thyroid to be able to do that. But people that have the conversion issue, which is extremely common, functional hypothyroidism, we treat that all the time and help them work effectively. So it depends on what's going on. If you don't have Hashimoto's or you just barely have it, you definitely don't need to be on thyroid hormone, and we could get you off your thyroid medication.
Now, you mentioned that with the Hashimoto's, and you talk about some of these labs that people should take, right, to actually see if they really do have a thyroid issue. How can they tell if they have a Hashimoto's or an autoimmune issue that's causing the thyroid problems? Mm-hmm. What labs should they run with that?
So for Hashimoto's, I'm looking at it's called thyroid peroxidase and thyroglobulin antibodies. So if I'm thinking someone might have Graves' disease, it's actually when you're producing way too much thyroid. I order something that's called thyroid stimulating immunoglobulin. So these are some autoimmune things that could be going on with your thyroid, damaging your thyroid function. And I always look at this when I'm assessing the thyroid to make sure they don't have an autoimmune condition. Now, a lot of doctors don't care if you have an autoimmune condition or not, because they're not going to treat you differently. They don't order these markers because, like, if you do have Hashimoto's, it's very common. 80% of people that have a thyroid disorder have Hashimoto's, and we don't really treat that. We just give you thyroid hormone. It doesn't really make a lot of sense to me, because then your thyroid just keeps on getting worse and worse, and then you have to take more thyroid and more thyroid and more thyroid. So it doesn't make a lot of sense. And also, you might get other autoimmune conditions in the future throughout your entire body. So it's very important to find out, okay, let's say you have a thyroid disorder and you haven't really been diagnosed with Hashimoto's. You need to take a look at that, because then you actually have to treat that autoimmune reaction. And we have a lot of other podcasts. We really dive into how to treat autoimmune disease and how to dive into that. If you want to learn more about thyroid or other medical conditions, click the videos to the right. I'm Dr. Jake, and I'll see you there.